Health issues. Dogs may lose their appetite due to various health problems, such as dental issues, gastrointestinal problems, infections, or pain. If you notice any other symptoms or if your dog's lack of appetite persists, it's important to consult a veterinarian. Change in routine. Dogs are creatures of habit, and even small changes in their routine can affect their appetite. If there have been recent changes in your dog's environment, such as a new home, new people, or a different feeding schedule, it may take some time for them to adjust. Food preferences. Just like humans, dogs can be picky eaters. They may simply not like the taste or texture of their food. It might be worth trying different brands or flavors to see if your dog's interest in food improves. Stress or anxiety. Dogs can experience stress or anxiety, which may affect their appetite. Major life changes, loud noises, separation anxiety, or the presence of other animals can all contribute to a dog's decreased appetite. Spoiled food. If the food has gone bad or spoiled, your dog may refuse to eat it. Always check the expiration dates and ensure proper storage of the food. If your dog's lack of appetite persists or is accompanied by other concerning symptoms, it's best to consult with a veterinarian to rule out any underlying health issues and get appropriate advice. Consulting a veterinarian is important when your dog is not eating food because professional expertise. Veterinarians are trained and have the expertise to diagnose and treat a wide range of health issues in animals. They can perform a thorough examination of your dog, ask relevant questions, and provide an accurate diagnosis based on their knowledge and experience. Identifying underlying health problems. A loss of appetite in dogs can be a symptom of various underlying health conditions. Veterinarians can conduct necessary tests, such as blood work or imaging, to identify any medical issues that may be causing the decreased appetite. Early detection and treatment of these conditions are crucial for your dog's well-being. Tailored advice and treatment. Veterinarians can provide personalized advice and treatment options based on your dog's specific condition. They may recommend dietary changes, prescribe medications, or suggest further tests or procedures to address the underlying cause of your dog's decreased appetite, preventing further complications. A prolonged loss of appetite can lead to weight loss, malnutrition, and other complications in dogs. By consulting a veterinarian, you can address the issue promptly and prevent any further health problems from arising. Peace of mind. Seeking professional help from a veterinarian can give you peace of mind, knowing that you are doing everything you can to ensure your dog's health and well-being. They can provide guidance, support, and reassurance during a stressful time. Remember, while online information and general advice can be helpful, it's always best to consult a veterinarian who can evaluate your dog's specific situation and provide appropriate recommendations for their care. Dog vomiting water and not eating? What you need to do, if your dog is vomiting water and not eating, it is important to take action to address the situation. Here are a few steps you can take. Monitor your dog. Keep a close eye on your dog's behavior and symptoms. Note how often they are vomiting, the consistency of the vomit, and any other accompanying symptoms such as lethargy, diarrhea, or abdominal pain. This information will be helpful when you consult a veterinarian. Withhold food and water. Temporarily withhold food for at least 12 to 24 hours to allow your dog's stomach to settle. However, it is essential to provide access to fresh water to prevent dehydration. Offer small amounts of water at frequent intervals or consider ice cubes for them to lick. If vomiting continues despite withholding food and water, contact your veterinarian, check for other symptoms, examine your dog for any other signs of illness or discomfort. This includes changes in behavior, breathing difficulties, pale gums, or any other abnormality. These additional symptoms can provide valuable information to the veterinarian. Contact your veterinarian. It is crucial to reach out to your veterinarian as soon as possible. They can provide guidance based on your dog's specific situation. Describe the symptoms, duration, and any other relevant information. They may recommend bringing your dog in for a physical examination or provide advice over the phone. Follow the veterinarian's advice. Once you've consulted with your veterinarian, follow their recommendations carefully. They may request further tests or suggest specific treatments based on their assessment of your dog's condition. It's important to adhere to their instructions to ensure the best possible care for your dog. Remember, vomiting and loss of appetite can be signs of various underlying health issues, ranging from minor digestive disturbances to more serious conditions. Seeking veterinary attention is crucial. If your dog is vomiting yellow foam, it could indicate several potential causes. Here are a few possibilities. Bile. The yellow foam may be due to the presence of bile. Bile is a digestive fluid produced by the liver and stored in the gallbladder. When a dog's stomach is empty, bile may accumulate and irritate the stomach lining, leading to vomiting. Gastritis. Gastritis refers to inflammation of the stomach lining. It can be caused by various factors, such as dietary indiscretion, ingesting something inappropriate, abrupt diet changes, infections, or certain medications. Vomiting yellow foam can be a symptom of gastritis. Acid reflux. Acid reflux occurs when the stomach acid flows back into the esophagus. This can cause irritation and lead to vomiting, often in the form of yellow foam. Certain factors like obesity, hiatal hernia, or an improper feeding schedule can contribute to acid reflux in dogs. Dietary issues. Feeding your dog on an empty stomach or using an inadequate diet could contribute to the production of excess stomach acid and vomiting of yellow foam. Other underlying conditions. In some cases, vomiting yellow foam could be a symptom of an underlying health condition, such as pancreatitis, liver disease, or intestinal obstruction. These conditions may require veterinary attention to diagnose and treat properly. If your dog is vomiting yellow foam, it is advisable to monitor their behavior and contact your veterinarian for guidance. They can help determine the underlying cause and provide appropriate advice or recommend further diagnostic tests if necessary. When your dog is vomiting, there are several steps you can take. Here is some general advice on what to do. Assess the situation. Take note of the frequency and consistency of the vomit. If your dog is only vomiting occasionally and appears otherwise healthy, you may be able to manage the situation at home. However, if the vomiting is severe, persistent, or accompanied by other concerning symptoms, it is best to consult a veterinarian. Withhold food and water. Give your dog's stomach a rest by withholding food for 12 to 24 hours. However, ensure they have access to fresh water to prevent dehydration. After the fasting period, gradually reintroduce small, bland meals to their diet, such as boiled chicken and rice. If the vomiting continues or worsens during this time, seek veterinary advice. Monitor for other symptoms. Keep an eye out for additional signs of illness, such as diarrhea, lethargy, loss of appetite, or abdominal pain. These symptoms can help you and your veterinarian better understand the underlying cause of the vomiting. Provide a calm environment. Ensure your dog has a quiet and comfortable place to rest. Minimize stress and avoid activities that could worsen their condition. Rest is crucial for the healing process. Contact your veterinarian. If your dog's vomiting persists, is severe, or is accompanied by other concerning symptoms, it's important to seek veterinary advice. Contact your veterinarian to discuss the situation and follow their guidance. They may recommend bringing your dog in for an examination or provide advice over the phone.